Now, for a more in-depth look at the latest global COVID numbers and new vaccines push, I am joined by Kate Tulenko, the founder and CEO of Corvus Health. Kate, as always, thank you very much for joining us.
Pleasure to be here.
You know, let's start in China because it is so difficult to revisit this. People in parts of China again and again rushing to get food, other supplies before this lockdown. What is the latest, and what can somebody tell the beleaguered people in that nation at this point?
Well, as your reporter mentioned previously, up to about 3 million people in China recently have been under lockdown, and the food shortages and the business disruptions that come with it, as well as the social isolation. But there is thought that the Congress Party meeting in October, that the Communist Party will start to ease restrictions and will start to move away from this zero COVID policy, because of course it's not possible to maintain that indefinitely, and at some point China does need to pivot to living with COVID. So there is some hope that that process will begin after the October meeting.
That'd be very interesting. Now, kids are going back to school, so what's the latest there?
Well, schools have a variety of different approaches. Very few schools in the U.S. are requiring masks, but most are doing increased measures such as increased cleaning, better ventilation, social distancing, encouraging better hand hygiene amongst the children. But I think we will definitely see a bump as schools return. There's no doubt about that. But you also have to think about the fact that schools are having to deal with monkeypox, as well in New York, the possibility of having a polio outbreak, because not only has there been a case of paralytic polio, but with the amount of polio virus that's been found in the sewage water in New York City, it's thought there have been asymptomatic cases.
You know, that is another story, but that is just horrific to hear that. Now, summer coming to a close, warmer months turning colder. The U.S. has said no to more free COVID tests being handed out. But what about winter coming? Temperatures bringing another outbreak here, perhaps?
Well, the people who've been modeling the COVID don't think there'll be a major bump. I mean, there will definitely be some increase. And my guess is that we'll actually see more influenza this year, as people, stop masking and get around more. And what I think we should keep an eye on is, people who have COVID and influenza co-infections, they tend to be more sick. And also, the possibility that with COVID co-infections with any other virus, that there could be a recombination and a new virus could emerge.
It's interesting you talk about stop masking, because early on in this, we were talking about the long-term changes that could come out. And one of them was people are going to wear more masks, especially to avoid influenza. But the fact that much of the world is operating as though it's business as usual, one could make the argument that this is a cause for concern.
It is in a way, but the positive side is people who want to wear masks can. Masks are now readily available. They're affordable. The N95 masks, and also in most cultures, it's now socially acceptable to wear a mask. Especially for older people or young children. So I think that this is going to evolve into a matter of individual choice, people thinking about their own risk profile, the risks of their loved ones, and masking or not accordingly. I'm still recommending everyone mask in high-risk situations,
right,
such as crowds, public transportation.
What about global vaccinations? I just recently came back from Afghanistan. I stopped in several countries there and on the way back, and I got to be honest, I didn't see any masks.
Yeah. I mean, it does vary country to country. And on the global vaccination scale, the vaccinations have been pretty static. I think the one country where we'll see a dramatic increase will be China, as they really push to increase vaccinations amongst their elderly. And the news of the new inhalable vaccine is actually quite encouraging. A surprising number of people have needle phobia. And plus, when you give a needle-based vaccine, there's risks of the bloodborne infections, a lot more material to be thrown away, whereas the inhaled vaccine can be much cheaper and much more easy to deliver.
Let me ask you one question. Do you know anybody who has not had COVID yet?
There's still a few people. Yeah, I finally got it about 3 weeks ago. But yes, there's still a few people who are not aware that they've gotten it. They may have gotten a silent infection, but I imagine there are still quite a few people. But as life has been returning to normal, that number has been decreasing.
Great. Kate, it's always a pleasure. Thanks. That's Kate Tulenko, founder and CEO of Corvus Health. Again, thank you for joining us. Well, up next.